we have been talking about modeling, model calibration, and a lot of stuff like that. And then we have talked about sensitivity analysis. We have talked about calibration. Now that's what you just finished, when you are trying to fit and then parameterize. So now we need to get some things clear from those point of view, and I quickly need to preach on this before we move on. Now, when we talk about model assessments, there are about 4 different things that we are looking at when you are going to assess a model. Now, number 1 is sensitivity or elasticity analysis, uncertainty analysis, model comparison, and model validation. Now, all of these have relationship, and and then they are linked with each other. Now, you will find out that from this workshop from this school from last week, we started with looking at sensitivity analysis, and then some people have come to talk about many other stuffs, and then we have talked about today we have talked about model since yesterday, model comparison and all that. Now, all of these are various aspects of model assessment. Now, in trying to assess your model, there are 4 things you carry out. You carry out sensitivity analysis, uncertainty analysis, model comparison, model validation, and then the one other thing I'm going to talk about lastly is the model selection. Now, sensitivity analysis, you have looked at that. It has to answer the question on what extent does the answer depend on the parameter values. To what extent does the answer, that's the question you are answering from sensitivity analysis point of view. And then one basic thing about sensitivity analysis is that you are actually measuring sensitivity index with respect to of a quantity with respect to a parameter, any parameter. I'm just using P here. So, and then you are looking at the change, the percentage change in this quantity Q all over percentage change in quantity P. So, in application to modeling, you are using reproduction number against some of the parameters in the model. But sometimes you are not working with infectious disease modeling. You are doing some other thing. So it's a general, so it's just been applied to, it's a concept used when it comes to model assessment. But it's been applied in epidemiological model to check the what extents our output depend on the parameter value. So that is how are the parameters being influenced. Some of the parameters, what are those parameters in the model that are influencing the model most? You understand? So, and then those parameters are sensitive in the sense that they can drive transmission or infection in a particular place much more than the other. So, and then under that, we begin to look at this definition of sensitivity is local because the sensitivity is computed while all parameters, including parameter P, are kept at their estimated values. So when you are looking at sensitivity at a local level, you are looking within the neighborhood, not a large number of parameters. So, and then that's why we have local sensitivity analysis and then the global. Now, despite the simplicity, however, this approach does not fully explore the input space, since it does not take into account the simultaneous variation of input parameters. So another drawback of this definition of sensitivity is that it depends strongly on the magnitude of P and the quantity Q. Now, in this respect, a much more useful concept is elasticity, which gives the parameter percentage change in quantity Q with respect to the percentage change in a parameter P. So which Q can represent your R0 and then P can be any parameter in your model that is also part of the R0. Because normally, if you calculate your R0 very well, your R0 is supposed to contain all the parameters in your model. Now, if you are doing R0 and if you find R0 and you are finding out that there are some parameters in your model that are not found, your R naught is questionable. So when you find R naught, all the parameters in the model are well represented in an R naught, because that determines whether the disease is going to spread or the disease is going to be truncated. So it determines the equilibrium prevalence of the disease, and then determines whether the disease is going to stop. So now, estimation of parameters and initial condition through fitting is often subject to variation. Now, when you are estimating parameters, there are a lot of variabilities that comes in. So, and that's why most times we tend to put the parameter in range. Especially, you know, if you look at the time series forecast somebody was doing, you find out that the forecasts were given in certain percentage confidence interval, the lower and the upper, and then you have the real forecast in the middle. So this is to take care of some of these variations that goes on in parameter estimation. No, and then the prefix parameters are selected from a range. So most times, you know, like, you know, some of our papers, you are seeing that somebody is writing a model, has developed a model given certain parameters, and then the parameters are fixed. They are fixed without giving a range. Now, we are supposed to, like, now if you are, even though you are using a baseline parameter, now a baseline parameter can be 5, but there is a particular range that 5 is coming from, maybe between 1 and 10. So you know that your 5 is coming within that range. So then for you to say, oh, the parameter is 5, and then you cannot really, especially when you don't know, you don't have the domain knowledge about that parameter, it becomes a challenge. So most times it's always good to come from the point of view of putting, not having a point estimate, but rather an interval one. So varying the parameters varies the output of the model, but which parameters have the most significant impact on that output? So the goal of sensitivity analysis is to decide qualitatively which parameters are most influential. That's the goal of sensitivity analysis. Which parameters, you can see now, parameters, not just one parameter. Which parameters are most influential in the model output? So sensitivity analysis can be performed on a dynamical system, like even on those SI. SIR, you can perform sensitivity analysis on those variables, not just on the parameters only, or on static quantities such as the reproduction number or equilibrium prevalence. Equilibrium prevalence means endemic equilibrium. Now, to perform sensitivity analysis of a dynamical system, we assume that the differential equation depends on a parameter P. So the parameter may be one of the coefficients in the system or one of the initial conditions. So the solution of the initial value problem can be thought of as a function of both the time variable and the parameter P. So a parameter is cost sensitive if small changes in the value of the parameter produce large changes in the solution of the differential equation. So that means if you add something small to that parameter, it changes the behavior. And you know, like, in modeling, what we are looking at is not, see, a lot of us are doing modeling, and then you are saying Lassa fever using ADM approach. Now, that's not the focus of modeling. Now, in modeling, we are studying dynamical systems. Now, in numerical, you are finding solutions, convergence, and all of that. So, there is a different thing. I don't need a numerical scheme to get to understand the system. What I need is, I'm studying dynamical system with the aim to find attractors. If I'm from the point of view of mathematician, to find attractors, to find fixed point, to find stability. Are you getting me now? From the point of view of mathematics. So I'm studying mathematical model from the dynamical system point of view, not from the view of a numerical analyst who is interested in finding the error and all of that. So these are two different aspects. So I've seen some paper, they are looking at ADM, and the question I asked, the ADM you used, who made it? You are not the one. It's Adomia. The VIM you use, VIM, that's variational iterational method. You are not the one. Somebody produced it. You are just using it. So what did you do that was new? Nothing. So it's not just about looking at, so in modeling, when it comes to qualitative aspect, I was telling you about qualitative analysis and then quantitative analysis. Now in qualitative analysis, our focus is on fixed points. You want to study the fixed point of the dynamical system, the SIR. You want to study the attractors. What are the attractors in the model? You are looking at the phase angle. You are looking at directional fields and all that. And then you want to study the stability, either global or local stability. These are limit cycles and all that. So these are things that has to do with dynamical system. The theory of dynamical system is our focus when it comes to qualitative analysis of the model. So it's not trying to do ADM or using numerical scheme and all that. That's not the focus of a mathematical modeler. A mathematical modeler, when it comes to qualitative analysis, is studying the qualitative behavior of the system, not necessarily giving solution, numerical solution. Now, local sensitivity analysis is a sensitivity analysis that examines the change in the output value that results from change in one input value, local, in the neighborhood. Change in one input value, one input parameter. So, global sensitivity analysis examines the change in the output values that result from the changes in all parameters. So you see that when Mogojudi was talking, he was looking at a large space of parameter. When he was using PLCC, you remember Latin cube, all those ones. So he was talking about, in the large, sensitivity in the large, not just in the local bound, in the large. So it's different from the other one. So to perform global sensitivity analysis, we have to expand the system to include all parameter values. So this is clearly a very computational intensive problem, particularly for large models. So a good review is Dickinson and Gellinans in 1976. That's one. Yeah. So and then elasticity analysis is talking about to what extent does the reproduction number depend on particular components of transmission? To what extent does the reproduction number depend on a particular component of transmission? So the elasticity of quantity may be Q with respect to P is defined as that. So that is percentage change in Q all over percentage change in P. The sensitivity or elasticity of Q with respect to P is positive if Q is increasing with respect to P. And then negative if Q is decreasing with respect to P. Now, uncertainty analysis. Now, this is another aspect of model assessment. Now, you have what range of answers are produced. That's the question you want to answer when you are engaged with uncertainty analysis. What range of answers are produced by a plausible set of parameter values? Now you have, for alpha, you are having 0.5, 1, 1.5, 2, 2.5, 3, 3.5, maybe up to 10, if it's a rate. If it's a rate, you can push it on a large set. But if it's a probability or a proportion, it's between what? 0 and 1. So, and then, uncertainty analysis is a systematic process of identifying, quantifying, and evaluating the effect of uncertainty in the input of a model or system on its output. Now, that was why I was saying that now you don't just come up with especially when you don't have domain knowledge about a particular parameter and you are fixing it. Take for instance alpha, which is recovery rate. You just fix any value. You cannot just do that. Now alpha is what? Alpha is 1 over infectious period, which is recovery rate. Are you getting me now? It's a clinical epidemiological data. It's not what you can use cases to fit. Like take for instance now, the cases of malaria, you can't use it to fit alpha. You can't, because it's not gotten from a number of cases, reported cases. So the data you are using to fit is reported cases from hospital, either from public or private. So the parameter alpha is not alpha is not is a clinical epidemiological parameter. So it has a relationship with the infectious period. Are you getting me now? So you can't use your number of cases to fit that. Some of us who have done that in our model is wrong, because it's an clinical epidemiological parameter. So the field data are collected. So that's why in getting certain parameters, you need to check, because even for infectious period, do you know that infectious period is given a range? For a particular, let's say for instance, like influenza, is between maybe 5 to 10 days. They are in range. Do you agree with that? It's not fixed. So these are things we must note when we are dealing with parameters. So it aims to understand how much the variation or lack of precise knowledge about input parameters contribute to the variability or imprecision of the model's prediction, conclusion, and decisions. So in essence, it answers the question, given that we don't know the exact values of all our inputs, how confident can we be in our results, and how much might they vary? That's the question. So that means you are factoring. So when you are putting your parameters in range, you are factoring variation in your model. So when you do that, you could say maybe between 1 and 10, and then you have used a baseline parameter. Between 1 and 10, a baseline parameter could be 5, could be 2, could be 3. And then it may be one of them that is fitting that particular data you are having. It may not be all. It may be 2 of them that fit it better. Maybe one is fitting it optimally. Are you getting me now? So one may fit it optimally, but you cannot, until, if I bring another data of another state, it may not be the same thing. So you have to put in variation into what you are doing. Now, uncertainty quantification, calibration often precedes or is integrated with uncertainty analysis, as the uncertainty analysis in parameter estimate propagates to model outputs. Now, there is a relationship between model calibration, and uncertainty analysis, in the sense that you have to calibrate first. What do you mean by calibration? You are trying to get a parameter, you are adjusting a parameter to fit your model. So in the course of carrying out model calibration, you are doing 2 things. You are doing parameter estimation, and at the same time you are doing what? You are fitting. You understand? You are fitting a model with your data, right? You are fitting a model with your data. Yeah. So that is what it means there. Now, what are the key concepts in uncertainty analysis? This refers to any lack of perfect knowledge about the true value. Like, I don't have perfect knowledge. My domain knowledge about the parameter is weak. I don't know. Maybe because of lack of data. So, of a true variable or the true form of a relationship. So it can rise from measurement errors. Now, measurement errors, imprecision in data collection, or stochastic variability, inherent randomness in the system. This is often irreducible. Lack of knowledge due to incomplete data, insufficient understanding of physical process, or model approximation. This can potentially be reduced with more research or data. Now, subjective judgment you can do is that expert opinion used when data is scarce. So when you don't have enough data, then what do? You search the literatures. Who are the experts in this area? What have they used? What kind of parameter they have used? You understand? When it comes to malaria, we have some people who have worked. And in my first that's overview of infectious disease, I will have presented some of the things people have done, but there was no time on malaria, starting from 1911 till date. Yes. So from Ross. So I have a kind of what's it called? A pictorial equation of different kind of model people have developed, from Ross model to what people are doing in the 21st century. Now, So you need people, so if you are doing modeling in malaria and you didn't check anything on ROS, you have not started. Yes, you have to go to the fathers. Who are the fathers in this area? You are doing something in a particular area. Who are the fathers? Who are the people that started it? You start tracing from that point to be able to get what are the domain knowledge. So that was why I was talking about, sometimes you may need to refer to expert opinions. Expert opinion used when data is scarce. When data is scarce. Now, other thing is model and system. This is the mathematical or computational representation of a real world phenomenon. It takes various inputs and produces outputs. Another thing is looking at the inputs. These are parameters, the variables or assumptions that go into the model. So they are the sources of uncertainty. The parameters can be a source. The variables, when you have an initial condition that you are not sure about, right? You put an initial condition for a particular place. You don't know the population. You don't know the number in the population. It can affect the output of your model. So all of this can influence the output you are getting. So these are the results. The output are the results, the predictions or decisions generated by the model. These are what we want to understand the uncertainty in. We want to understand the uncertainty in your results. What are the uncertainty in your predictions? You give the 95% confidence interval, or depending on what you use. If you use a frequency, it's like Olashukwu came and did something on least square. That's a frequency. There are various ways you can optimize a model. You understand? So one of them is the least square, but least square is not the least actually. So there's a trial and error method that you can use, but it's subjective in trying to match the model to the data, but it has limitation. Then after that, you talk about least square, you talk about maximum likelihood, you talk about evolution algorithm, like genetic algorithm, and the swamp algorithm. And then you talk about, those are frequentist approach. Then you talk about the Bayesian, which is run by MCMC. So the Bayesian, now the one he has used is frequency approach, which is actually, you can get the confidence interval and you can use confidence interval, but for Bayesian, which is run by MCMC, you can get the credible interval. So now steps in uncertainty analysis. While specific methodology can vary, a general process involves identify sources of uncertainty. 1, which input parameters are uncertain? You need to ask. When you are doing model, you don't just do model anyhow. Which input parameter? Is it alpha? Is it uncertain? Are there uncertainty around alpha? Are there uncertainty around the birth rate or the net rate or the disease-induced death rate? Are there uncertainty around them? Are there uncertainty around what are the potential ranges of this parameter? You have to ask. So in literature, you find out this parameter I'm using, what are the potential ranges? Like for influenza, the range of infectious period is different from malaria. So you have to check. Incubation period, what is the range? What's it called? Infectious period, incubation period, and then I didn't hear you. Latent, good. Latent period. So are there uncertainty related to the model structure itself? The model structure. Do you have uncertainty? And then characterize uncertainty. Quantify the uncertainty from each input. This often involves assigning probability distribution, like binomial, uniform, normal, uniform, beta, and all that to uncertain parameters based on data, expert judgments. Like people who are, like, take for instance, that's why I was saying that it's good to work with others who are in the field, who are working with the biology and all that. So, or previous studies, consider correlation between uncertain inputs. Now, propagate uncertainty through the model. This is the core of the analysis. It involves running the model multiple times. Each time drawing values for the uncertain inputs. Now, I'm saying that alpha is 0.5, 1, 1.5, or 2, 2.5, 3, 3.5. So I want to check if I'm varying all those ones, how does my model look like to really satisfy my uncertainty. So now, each time drawing values from the uncertain, if alpha is 0.5, what am I bringing out from the uncertain inputs? From their defined probability distribution. Then, common method include all of this: Monte Carlo simulation, Latin hypercube sampling, analytical method. Like for simpler model, mathematical formulas can sometimes be used to directly derive the output uncertainty using Taylor series expansion. Now, we can analyze and present results like summarize the distribution of outputs. This might include calculating the mean, median, the standard deviation, the confidence interval, or specific pattern types of the outputs. And then we visualize by histograms, box plots, cumulative distribution function. And then interpret the implication. What does the uncertainty in the input mean for decision making? If you are seeing any uncertainty, what do they mean? How do they apply to real life? These are things you need to look at. Now, it has some relationship with sensitivity analysis. Uncertainty analysis is often performed in conjunction with sensitivity analysis. Uncertainty analysis focuses on how much the output varies due to input uncertainties. You have imputed uncertainty in the inputs, like alpha is between 1 and 10, a lot of range. And then, what do we get in terms of the output when you put all those variations? Now, sensitivity analysis focuses on which input parameters are most responsible for the variation we are seeing. You have checked, like take for instance your XR model, you have alpha, beta, and all that. So which of them is influencing the dynamic of the model most? That's what sensitivity analysis focuses on. But uncertainty analysis focuses on how much is what? Quantity. How much the output varies due to input uncertainties. How much? What's the percentage? Now, the sensitivity focuses on which input parameters are most responsible for the variation. It helps to identify the most influential parameters, allowing researchers to prioritize data collection or research effort to reduce the most impactful uncertainties. Why is uncertainty analysis important? 1, credibility and robustness. It enhances the credibility of model results by explicitly acknowledging limitations and quantifying the range of possible outcomes. Are you getting what I'm saying now? You are telling us that, oh, your model is not the super. There are variations. There are uncertainties around it due to the parameters, due to the behavior of the parameters. Now, why is it important? Informed decision making. It provides decision maker with a more complete picture of risk and potential outcomes, moving beyond single point estimates. So because you are providing a range, you're already saying that within this range, this can happen. So somebody else is using that same range. It may not be the same way you have used it. They may not use the same value you have used, but they may use some values within that range and get similar results. So this helps in making more robust decisions on that uncertainty. Risk assessments. Why? Risk assessment. Crucial for quantifying risk in areas like engineering, finance, environmental impacts, and all that. Now, resource allocation, communication. In the field of climate modeling, financial forecasting, and epidemiological prediction, uncertainty analysis is an indispensable tool for providing a realistic assessment of future scenarios. So, resource allocation talks about by understanding which uncertainties matter most through sensitivity analysis, resources for further research or data collection can be allocated more effectively. So, in terms of guiding in control. Now, model comparison. The question we are answering is, to what extent are the model form and complexity supported by the available data? To what extent are the model form and complexity supported by the available data relative to other models? So model comparison is the process of evaluating and selecting the best model from a set of candidate models that have been trained or fits on the same data. Right? So you are just not having one model. You know, like some of us, we have been working on just one model, you feed the model, you will do prediction. But when it comes to model comparison, you have, if you look at what Mogbojuri did, now when he put up the, was using there's a function there he used, when he wanted to check for different model for ARIMA, you understand? So, and then it brought different kind of model, the one that is 500, 200, 202, 201, there are different models. So at the end of the day, now I'm going to talk about that, which has to do with, now there's a method for checking, which is what we call model selection. After model comparison, we do model selection. Now model selection comes in by, after you have seen so many models, now through the effort of AIC, that's Akake Information Criterion, or BIC, Bayesian Information Criterion, now you are able to select the best out of several models that have been shown. That was what he showed you the other time. Now we do this in time series. We can also do this in mathematical model. Now where you have different kind of candidate models, about 3 or 4 on influenza or on malaria, and you have fitted them, you have done this thing. After doing that, you may need to carry out what we call AIC on those mathematical model to check which one is what is giving the best, that's going to fit the data best. Are you getting me now? So that is what when we talk about model comparison, that's one of the things we do there. Now the goal is to identify the model that most effectively captures the underlying patterns in the data. Most effectively. You can have more than 4, more than 5, depending. More, but the one that most effectively captures the underlying patterns in the data, while also generalizing well to new unseen data. Now, it's a critical step in any modeling workflow, whether you are doing statistical modeling, machine learning, or simulation. Now, why is model comparison important? We want to prevent overfitting. So if you want to prevent overfitting means that your model is capturing, the model is capturing the data exactly without any, no space within. So that's overfitting. So a model that fits the training data perfectly might not perform well on a new data. So comparison helps identify models that generalize well. Now, when you put in an unseen data or you are doing cross validation, you will still get a good result in terms of the prediction. So optimal performance. Why is model comparison important? Optimal performance. It guides you towards the model that is most likely to make accurate predictions or provide the most reliable insights. So model comparison guides you. Like I told you about the UK foot and mouth, they had about 3 models. So although their outcomes were different, but they have very close results. And that's the kind of model comparison. So parsimony and interpretability. Sometimes a simpler model that performs almost as well as a complex one is preferred due to better interpretability and easy of use. Now, when you use a complex model, I was telling you the other day that it's difficult to track. But if you are finding that the result of a simple model is performing almost as well as a complex one, then why do you bother yourself? So resource optimization prevents spending unnecessary computational resources on overly complex model or ineffective simple ones. So those are the reasons why we carry out a model comparison. Then model validation. Model validation. Now, what do you mean by model validation? Can the model tell us about the world outside our data sets. Can your model tell us about the real world? That's validate. Now, your model must validate real life scenarios, and you need data to validate with real life scenarios. So, model validation is the crucial. Some of us in math, you say that the numerical results is validated. The model is validated by carrying out numerical simulation. It's a lie. I've seen many papers like that. It's wrong. You don't validate without data. And in fact, you must have carried out model calibration before you talk about model validation. And when you are saying model calibration, you have done two things. You have estimated parameters, you have also fitted. So, model validation is the crucial process of assessing how well a model represents the real world system. It's designed to simulate or predict, and whether its output are reliable and fit for purpose. It's about building confidence in your model's ability to generalize to new unseen data or situations. So it's distinct from model calibration. Fitting the model to data and estimation, that's model calibration. It's different from it. And it's also different from model comparison. Choosing the best among several candidate models, that's model comparison. Validation comes after these steps, these two steps. After model calibration, comparison, validation comes after these steps to give a final verdict on the choosing model's trustworthiness. So why is model validation important? It ensures reliability. A validated model provides reliable predictions and insights, which is critical for informed decision making. 2, a validated model prevents overfitting. Validation on independent data is the primary defense over overfitting. So, where a model performs well on training data, but poorly on new data, unseen data. So, building trust, stakeholders need to trust that the model's output are credible. So, they need to validate. Validation provides evidence for the trust, for this trust. The decision makers, the public health people, they want to build trust in your model. And it's only by validation you can do that. Identify limitations. No model is perfect. Validation helps to understand the condition under which the model performs well. Underline the word condition. So, validation makes you to understand what are the limitations and its limitation or ranges of applicability. Because at the beginning of your model, you have set a target question you want to answer. So your model cannot answer all the questions in the world. So in other words, when you are relating your model back to the real world, you have modeled malaria. Does it speak to the malaria in Benue State, the real situation? So, and then regulatory compliance. In many fields, models used for critical decision must undergo rigorous validation, like in healthcare, in finance, in engineering, to meet regulatory standards. You cannot just put flights on the air. And then you say that, like in Nigeria, a lot of people are, you know, you will go on Facebook sometimes, they say somebody just made an aircraft in Umaya or something like that. And then I say that guy that's a good rate. This and that is good. But even you will not enter that kind of plane. Because you have to pass the test of validation. I told you of professors who got to a place and then they wanted to enter a flight. And then immediately as they were entering the flight, they asked that who built this jet? And they said, it's your student too. The engineering student you taught in university. As soon as they were trying to enter, they just turned back. The reason is because they knew that what they have taught them is not enough to produce an aircraft. So they don't want to crash. So that kind of model must undergo validation. That's what we are saying. So there are regulatory bodies that does that, especially when you are like complex things like aircraft. You understand what I'm saying? It's very, that will carry thousands of people at the same time. So you don't joke with such things. Model validation is not one-time events, but an ongoing process. So especially for models deployed in dynamic environment where data patterns might change over time. And then regular revalidation is essential. So basis for validation, calibration is a prerequisite for robust model validation. You can't validate a model that hasn't been properly tuned to relevant data. Model selection. In mathematics, the model is typically postulated. Assuming the model, further analysis and simulations are performed with it. So the model is derived. I need to leave here in the next 1 or 2 minutes because I have okay. The model is derived from first principles, but how do we know that the model is reasonable? Those are the questions we want to look at. Selection. One way to justify our model is to confront it with data. If the model is reasonable and fit the data, then we may accept that it's a reasonable model to work with. Right? So a good model is one of the conditions I gave for a good model, if you have been following my class, is parameterizable. However, given a biological scenario, multiple models can be created. That was what I was talking about the other time. More than one. Given one, like just one biological scenario, you can create multiple models. For instance, in modeling HIV, we can set up a regular SI model. A regular SI model, this is one. Another one is a regular SI model with vertical transmission from the mother to child. And then an SI model with case stages of infectious individuals. That is multiple partners, sexual partners. So we would like to know which model is the best. You know, we have like, how many models do you have there now? How many models do we have here? 1, 2, 3, 5. Now we have an SI model with case stages of individual. Okay, 3. 1, 2, 3. And then we have cake and berry. And an SI model with case stages and vertical transmission. Now, we would like to know which model is the best model so that we may further work with it. If you are given data, we can confront all models with the data and decide which model best describes the data. So, but you cannot do this except with a method. Now, model selection is the task of selecting a mathematical model from a set of candidate models given the data. In model selection, we assume the data and look for the model that best describes the data. And then a set of candidate models has to be determined by the researcher. Look at those 3 different models I gave. And then you are now going to test each of them with the data, you fit them, and then the one that gives the best fit will then, apart from that, you are going to carry out what we call AIC. All candidate model will be reasonable, must be reasonable for the epidemiological scenario being model. Once the set of candidate model has been selected, the mathematical analysis can be performed to choose the best model. So one way that comes first to mind is to compare the model, is to arrange them by SSE. SSE, those are the things, some of the things that was presented in your former class. So you have the sum of square errors, which is the predicted minus the observed raised to power 2. So you have so the model with the least SSE will now best fit the data. So if you have 3 models, you have to check the SSE. The one that have the least SSE will now best fit the data. However, it is well known that the more parameters we fit, the better we can capture the data. But the additional parameters we fit may not represent anything useful. So a good selection criterion must balance 2 points. Number 1, goodness of fit. Number two, simplicity of the model. Now, in other words, a good selection technique must choose the simplest model that best fits the data. There are many statistical criteria that may be used to decide on the best model. Some of these are Akaike Information Criterion, AIC, the Bayesian Information Criterion, BIC, cross-validation. Then a good book on model selection is Boham and Anderson, 2002. And then one of the most frequently used selection criteria is the AIC, which is Akaike, done by Akaike. Akaike is the name of somebody, which we introduce here. I'm going to stop here going forward. Thank you very much for listening.